Hello, this is Molly Williamson, student PTA, and this is my lower extremity skill check. Before we get started, I just want to remind everyone of the signs and symptoms of a DVT, which is a deep vein thrombosis, or a blood clot in the leg. So if you are working with someone and you notice that they have a lot of swelling in their calf, and that there's warmth and tenderness and pain and redness, that could be signs that they have a blood clot in the leg. And you want to stop exercise right away and get that person medical attention immediately, because this condition can be fatal if it's not immediately addressed, because that blood clot, especially if you're exercising, can become dislodged and end up traveling to the heart or the lungs, where it can be fatal. So if you notice those signs, and you should be looking just to check whether someone does have those signs, if you notice those, you need to stop exercise and get that person help immediately. And while we're talking about precautions, I'm going to wash my hands and then go over some things that we should be extra careful about after someone has had either a hip replacement surgery or an ACL reconstruction. So for the hip, whether it's an anterior approach or a posterior approach, you want to be careful about bending the hips past 90 degrees. So that can be either bringing your knees up so that your hip is bent more than 90 degrees, or it could be where you're bringing your trunk down so that your hips are bent more than 90 degrees. And these are things you should be paying attention to, both in standing, as well as if you're sitting. You want to make sure that the person's not sitting in very low seats. So you probably want them to have a higher seat than this one, because you don't ever want the knees to be above the hips while the person is sitting upright, because that's going to mean that their hip is bent more than it should be. Also, if the person is laying down, it's okay if they have their knee bent while they're laying all the way down. It's okay if they sit up while their legs are straight, but you definitely don't want them to be sitting up in bed with their knee bent, because that's going to mean that their hip is bent more than it should be. So those are all precautions that you should pay attention to about just bending that hip more than 90 degrees. It's also really important that the person knows not to cross their legs, either when they're lying down or standing up or sitting. We want to avoid crossing the legs at all times. That's for both anterior and posterior approaches. For the posterior approach specifically, you also want to avoid rotating the hip inwards. So you don't want to be bringing the toes in if you're standing. If you're sitting down, this could also be if someone is trying to do something with their foot and like adjust their shoe. That's not something that is going to be a good idea for someone who's had a posterior approach hip replacement. So it's just really important to make sure that people know that they can't do this kind of thing. And there are devices that can help people to be able to put on shoes and socks in a way that's safe, and especially if they're reaching down, that's also breaking the rule of bending your hip. So it's really important that people learn new ways of doing some of the things they used to do, like putting their socks and shoes on. For the anterior approach, it's especially important that we avoid rotating the hip outwards. So in standing, that would be you're bringing your toes out, but also in sitting, you want to avoid bringing your foot inwards, because that's going to be rotating that hip in the direction that you don't want. And you also want to avoid anything where you're bringing your leg into your hip being bent and out and rotated out. So definitely anything where you're kind of bringing your foot up towards you is not a motion that you want to do if you've had a hip replacement with the anterior approach. And also always being cautious of the bending of the hips. So another thing that we need to avoid with the anterior approach is extending the hip. So that just means that this hip, so if it's the right hip, if it's behind, if the leg is behind where your hip attaches to your torso, that's not going to be something that we want to see in someone who's had an anterior hip approach. which means that if someone is walking and they've had a right hip replacement with the anterior approach, we don't want them to step forward with the left leg, because that's automatically going to put that right hip into the extension, which is what we want to avoid. So when we're walking with someone who's had that kind of surgery, we start with the affected leg, and then we bring the other leg to meet it. We just continue walking like that, because we don't ever want to put that hip in that position. Another thing to be thinking about with both of these approaches is just which direction you turn when your feet are on the ground. So if I'm standing here and I've had a right hip replacement and I turn to the left, what that does is that's actually kind of rotating this hip. So if I turn with my foot not on the ground and I turn the toes out, that's going to be rotating the hip outward. But if I have this planted and then I turn my body to the opposite side, that's the same motion for the hip as if I was standing here and doing that. So this is what we want to avoid if we've had the anterior approach. So you want to avoid standing and then rotating to the opposite side. But then if you've had the posterior approach, right, we don't want to be turning the foot inwards. So the equivalent of that, if you're standing, would be that you don't want to turn to the same side, because that's going to be the same thing as if you were turning your foot in, which we want to avoid with the posterior approach. So those are a lot of things to keep in mind, but if you continue to reinforce those ideas for the specific condition that the person has, then they can start to just adapt to doing things in a way that's going to be safe for that hip replacement. So moving on now to the ACL, we want to make sure that we're avoiding in the beginning phases of recovery for an ACL surgery any activities that are strengthening with the foot off the ground and the knee bent in that 15 to 45 degree range. So you don't want to be doing things where, especially if they have like an ankle weight on, they're bringing their leg up and down in that just slightly bent position, 15 to 45 degrees, because that's going to put a lot of stress on that healing ligament. You also want to make sure that you are paying attention to if they are a little bit later in recovery and you're starting to bear weight on their legs, you still want to avoid having them fully bearing weight and then doing deep squats or any activity where their feet are on the ground, their weight is there, and then they're having to bend their knees in the 60 to 90 degree range. So you want to make sure that you're not doing activities like this when they're in the medium protection phase of recovery. You want to make sure you wait until they're much further along and that they have the strength in the ligament that's healing, as well as the muscles, to be able to handle that kind of a load on the knees, because it really does put a lot of force in the knees when you're have all of your weight and you're bending your knees that far. So those are the most important precautions to remember after surgery. I know it's kind of a lot, but hopefully you're not working with anyone who has had all of those surgeries at the same time. So we are going to move on and discuss a couple of exercises that you can use for someone who has, well, for the first exercise, we're going to talk about an exercise for the subacute phase for a medial meniscus repair on the right. And then we are going to talk about an acute phase exercise you can use for someone who has patellofemoral dysfunction syndrome. So getting started with the first exercise for the subacute phase for a meniscus, we are going to do this exercise that's called side stepping. So to do this exercise, it's pretty much what it sounds like, is you're going to be stepping to the side. But you want to make sure that before you start, you have your patient bring their belly button towards their spine and hinge at the hips, and then take a controlled step to the side and then back. And then you can have the patient do this. You 10 repetitions, so just going out and back. And you just really want to focus with this exercise on controlling the motion of the hip and the knee, and making sure that the hip and knee stay in proper alignment. Because if you're doing this and your knee is bending in, that's going to put a lot of stress on that inside part of the knee where you're healing that meniscus. So the benefit of this exercise is that you're starting to do those side-to-side movements, and you're doing it just one step at a time, which makes it easy for someone to do in front of a mirror where they can watch what they're doing. And you're also doing it in a way that's slow and controlled, where they can really focus on doing it with proper form, and hopefully they can get used to doing it in a way that's safe, so that later when they're starting to return to sport and do a lot of lateral movements, that they'll have just gotten their body used to doing those movements in a way that's controlled and safe. So the main thing you want to look for is you don't want the knee to be coming in. The other thing you should watch for with this exercise is you don't want the person to be using their upper body. So they shouldn't be stepping to the side like that. We don't want to see penguin walking, because that's not going to really be working on what we want to work on. So make sure they bring their belly button towards their spine, and then hinge at the hips, and then take that controlled step to the side. And if someone is really struggling with just being aware of when their knees are coming in during this exercise, one technique you can use that might help is if you have a TheraBand that you can tie around the outside of their thighs, especially a light resistance. This is the only one I have, so I'll use this just to demonstrate, but ideally you wouldn't be using a loop, you'd be just tying it around, and it would be a light resistance. Because the purpose isn't to make it harder, but sometimes having just something around the outside of their thighs can just give people just kind of a mental nudge, or that they can feel. So if you're doing this exercise and then your knees start coming in, you're going to feel a change in that band. So if you think about keeping the band out while you're doing this step and maintaining that tension in the band, sometimes that can help people just to not be having their knees coming in while they're doing the sidestepping exercise. So that's one good exercise for the subacute phase of recovery after a medial meniscus repair. You definitely want to wait to do that exercise until the person is fully weight bearing. So often that's not until after maybe 8 weeks. So just make sure you're waiting until they're ready for it. But that's a good exercise you can use when you're getting closer to where you might start transitioning towards more lateral movements, but they're not quite ready to do it at the level of returning to sport. So for patellofemoral pain dysfunction, or patellofemoral pain, or patellofemoral dysfunction syndrome, you can do a straight leg raise in the acute phase of recovery. But this is a certain kind of straight leg raise that's especially good for these kinds of patients, because you do it with the knee slightly bent about 20 degrees and with the toes rotated out. So what this does is bending the knee a little bit just takes some pressure off of that kneecap, which is really good for people who are having that pain, because you don't want to have the knee fully straight, because that can just be irritating and really uncomfortable. But this bending the knee slightly just makes it more comfortable for these patients. And then having the toes rotated out means that you're working the muscles on the inside of your thigh a little bit more, which can be really helpful for this condition, just because if the muscles on the outside of the leg are working more than the muscles on the inside of the leg, that can be pulling that kneecap towards the outside rather than having it balanced and in alignment as the person's moving, and that can be one of the contributing factors to this kind of pain. So if we're working on those inside muscles more, that can be really helpful. So you would just bring the leg up. I can feel those muscles working. And yeah, another muscle that people will talk about specifically is the vastus medialis oblique, and when you are strengthening those inside muscles, that can also help to strengthen specifically that VMO as well. So, so that's one exercise you can do. You can have them do 2 sets of 10 repetitions. They could do it every other day just so their muscles have time to recover. With that sidestepping exercises, 2 sets of 10 every other day could also be appropriate. But as the clinician, you should look at the individual patient and just see what would be best for them based on what they're able to do and how difficult it is for them. So those were the exercises that I wanted to show you. And now we're going to take a field trip into the other room so we can talk about how to move around in bed after a knee or a hip surgery. So here we are. I'm just going to bring this down. You can see. So if someone has had a hip surgery and they're laying in bed, we can say it's the right hip. We want to make sure that we are following all of the precautions as we're moving towards sitting up. So making sure that we're not sitting up like this because we don't want the hip to be bent more than 90 degrees. So making sure we keep the torso back as we're moving around, using the unaffected leg to help move, and making sure that we keep this hip in alignment. So we want to make sure that that this hip is in alignment, facing up, that we are not letting it turn in or out, that we're keeping it just steady. You can use your hands, just making sure you're not bending that hip too much. And if you need to, you can scoot sideways as long as you're making sure you're keeping your hip in that proper alignment. And as you get towards the edge of the bed, you want to make sure that you have your unaffected leg where it can provide support as you're moving into standing. And then to go back, it's the same thing. You want to make sure that you're not rotating at all in this hip. You want to make sure that you are bringing your torso back so that you're not bending past 90 degrees. So that's how you can move when you've had a hip surgery. If you've had a knee surgery, then you don't have to worry about the hip precautions, but someone might maybe not have the ability to straighten their leg all the way, and you want to avoid any extra rotation and forces to that knee that don't need to be happening right after surgery. So you can do the same thing using the unaffected leg to help you get closer to the edge of the bed if you need to, and then using these hip muscles just to hold that knee in a gentle way so that you can just control the forces on it as you're moving. And then to get back, just making sure that you're being careful with that knee and using your hip to really control that leg and just not let the knee be flopping around. So those are just the things that I wanted to share with you today. If you have any questions, feel free to contact me. Molly Williamson, student physical therapist assistant. It's been a pleasure working with you, and I hope that you have good luck with whatever recovery or rehab you might be needing to do, or that you just find this information useful for whatever it is that you need it for. Thank you. Have a good day.